AAPC CPC Exam Review Practice Test and Study Guide 25 Must memorize questions. Question 1. An established patient is seen in the office for dizziness and palpitations. Which E/M code range is used? 99,202 to 99,205, 99,212 to 99,215, 99,281 to 99,285, 99,231 to 99,233. 99,211 to 99,215 are for established patient office visits. Question 2. A patient is admitted and discharged on the same day. Which code category is reported? 99,221 to 99,223, 99,238 to 99,239, 99,234 to 99,236, 99,217. 99,234 to 99,236 is for observation or inpatient care including admission and discharge on the same date. Question 3. A physician spends 20 minutes on the date of discharge. Which code is reported? 99,238, 99,239, 99,217, 99,291. 99,238 is for hospital discharge services of 30 minutes or less. Question 4. Which modifier is used for an E/M service on the same day as a procedure? Modifier 51, Modifier 25, Modifier 59, Modifier 26. Modifier 25 denotes a significant, separately identifiable E/M service. Question 5. A patient has bursitis in both shoulders and receives injections. How is this coded? 20,610, 20,610 to 50, 20,611, 20,610, 20,610. Modifier 50 is used for bilateral joint injections. Question 6. Which code is for smoking cessation counseling, 3 to 10 minutes? 99,406, 99,407, G0436, 99,213. 99,406 is for 3 to 10 minutes, 99,407 is for greater than 10 minutes. Question 7. What does CPT stand for? Current procedural terminology, common physician tests, clinical patient treatment, coding protocol techniques. CPT is maintained by the AMA. Question 8. Which ICD-10-CM chapter covers diseases of the circulatory system? Chapter 9, I00, I99. Chapter 10, J00, J99. Chapter 2, C00, D49. Chapter 1, A00, B99. Chapter 9 is for circulatory diseases. Question 9. What is the term for the reason for the encounter in an outpatient setting? Principal diagnosis, first listed diagnosis, major diagnosis, admitting diagnosis. In outpatient coding, the first listed diagnosis is used. Question 10. Which HCPCS Level II codes are for medications? J codes. J0120, J8999, E0100, E9999, L0100, L4999, A0021, A0999. J codes are used for drugs administered other than oral method. Question 11. How many characters are in a full ICD-10-CM code? 3 to 5, 3 to 7, 5 to 9, 7 only. Codes vary from 3 to 7 characters. Question 12. Which CPT section includes anesthesia codes 00100-01999, 10,000 to 19,999, 99,202 to 99,499, 70,010 to 79,999. The 00100 series is for anesthesia. Question 13. What is medical necessity? The cheapest treatment available. Services that are appropriate and consistent with the diagnosis. Anything the patient requests. Any service provided in a hospital. Payers only cover services that meet medical necessity. Question 14. Which modifier is used for discontinued outpatient procedure before anesthesia? Modifier 52, Modifier 53, Modifier 73, Modifier 74. Modifier 73 is used for procedures discontinued before anesthesia induction. Question 15. A screening colonoscopy is found to have a polyp which is removed. The primary code is the screening code, the polyp removal code, both, with screening primary, both, with polyp primary. Screening is the reason for the encounter. Append modifier 33 or point depending on payer. Question 16. What is a new patient in CPT? One who hasn't seen the doctor in 1 year. One who hasn't seen the doctor or any same specialty partner in 3 years. A patient who just moved. One with a new insurance card. The 3-year rule defines a new patient. Question 17. Which organ is involved in a splenectomy? Liver, spleen, appendix, gallbladder. Spleen is the organ removed. Question 18. A code with a plus symbol next to it is called a standalone code, an add-on code, a revised code, a new code. Add-on codes must be reported with a primary procedure code. Question 19. What is unbundling? Reporting components of a code separately to increase payment, combining 2 codes, a type of billing error, removing a bandage. Unbundling is considered a fraudulent billing practice. Question 20. Which appendix in CPT lists modifiers? Appendix A, Appendix B, Appendix C, Appendix D. Appendix A contains the full list of modifiers and descriptions.